It should be noted that they sometimes achieve positive outcomes, provided they administer stem cells locally. For example, in the occlusal muscle, cells provide effect. It's hard to imagine that this being effective. As far as I know, there is a practice in Milan. For example, in Copenhagen, stem cells are injected into the heart muscle. We don't do that. Generally speaking, administering directly into the area where the disease is located is not advisable. This is absolutely clear. This depends on whether stem cells are actually harvested. The issue is that we say that this concentrate contains stem cells. We measure the count. We have special devices that can accurately separate stem cells from bone marrow or fat tissue. The trick is to separate such cells. We don't simplify the process using enzymes like it is done in Russia and Italy. In Germany, it is not permitted and prohibited. This is prohibited because, once again, something can happen to the enzymes since they can change cells. We don't do that. This will not bring any benefit, and such stem cells are ineffective. We derive stem cells using mechanical transfer methods, and they remain intact. Such cells undergo no change and thus are more effective. Besides, we also perform tissue stimulation. Without this treatment is also ineffective. If we simply inject stem cells in the system, this will not bring any benefit at all, since cells have to reach a certain area. That's why we use shock magnetic waves. Those are special waves which can be felt. Thermotherapy and other means to stimulate the area cause stress, but not in the common sense of stress, rather a stress to activate cells so that the stem cell can migrate to that area. Stem cells acquire so-called homing effect. Homing effect points out the location of the disease. If compared it to a firefighting team, the firefighting team knows exactly where the fire is. They don't go to all surrounding places or random places. They know the exact address. From the scientific point of view, homing effect modifies body signals, and miraculously stem cells know exactly where they should migrate. And if screams for help were everywhere, if joint screams for help and help is needed there, stem cells will travel to every area where it need be and provide the right effect. Thus, we may cry for help in an area that really requires stem cell, e.g. in the pancreas and other tissues, the liver or kidneys. We stimulate this area the most, but without causing any harm, and all stem cells migrate there due to the homing effect. Besides, these cells need to be directly administered by injections in the area in question. For example, 7 cubic centimeters of concentrated stem cell can be injected into the optic nerve or macula. This is not much. Such volume requires 1 or 2 administrations of injections. This is either prohibited or they lack expertise. We are often asked, how do you do this? How can you derive stem cells from fat without using enzymes? This is like Coca-Cola. This is a secret. It's simple. This is similar to a chef preparing dishes. Everyone knows the recipe. Everyone can buy necessary ingredients on the market. Everyone has a stove and everyone can cook. However, a chef will make a dish better than your average cook. Same applies here. This is just an art taking into account all these combinations. It's not just simply a case of injecting cells and that's it. It's not that simple. Derivation of stem cells alone is not the main issue at present. The skills to derive cells has to be acquired. The concern is also to use them where it is needed. Regarding paralysis, this really is a very good device. However, during the rest period between treatments, when a patient stays at home, he requires drug therapy. Those are small things that contribute to the general positive outcome. Because if you know just the general things without knowing the details, you are likely to fail anyway. This combination includes everything. Everything should be 100% used in conjunction with each other. Then only will it lead to success. Yes, but first you need to know the causes. Fibrosis is mostly a solidification, and it should be noted where. Yes, sometimes damaged cells cannot be restored, but you can activate remaining healthy cells that may possibly start to divide. Thus, healthy cells will divide And fibrosing cells will no longer cause liver damage and stiffness. To make an organ more elastic, the following agents can be used. For example, if the skin is dry, you can apply cream, which will be absorbed by the skin, making it fatty, which does not mean that we're trying to repair the skin. So here you can also add specific agents. Since the process cannot be reversed, and we cannot do that, but we can try, based on what remains, to improve and even to augment productivity. Quite often, the body is programmed in a way that division is ongoing, and 30% of the tissue can turn into 60%. If a half of the liver is removed, the remaining half will grow back. This ability is always present. If the liver is rather big and its half is non-elastic or contains a lot of fat, this half will not be removed. An effort is made to compensate its function by activating the healthy part of the liver to provide its recovery in such way. This is the right way. By all means, nephritis must be treated, and then an attempt to regenerate the kidney, and in case of inflammation, to observe the immune reaction. Since this depends on the immune system, using stem cell therapy primarily, we're trying to regenerate the immune system. The immune system cannot manage on its own with the disease, and it requires external support or administration of certain agents. Decisions should be made on a case-by-case basis. This is hard, but everything is specialized. In each particular case, the course needs to be monitored. But still, kidney cells can be activated.